can everyone see the slideshow? Just get the chat open on the left-hand side. All right, fantastic, great. So good evening, everyone. As you can tell from the energy that I bring to these webinars, as far as an educator goes, I'm really keen on engagement, particularly when it comes to calculations, because not a lot of people enjoy calculations, even though, oddly enough, it's one of my favorite areas of teaching. Um, so I'm going to get you guys to try and engage as much as possible. Pop questions in the chat. Hopefully all of you have calculators. Someone asked at the beginning what the aim of this session is, and it's really a nice little introduction that I run every year, just to talk through some sorts of tips and tricks when it comes to calculations. We will be going over some questions as well and actually working through some of them, and I'll spend some time talking about rationale, things to kind of look out for, but also sort of impart some wisdom with transferable skills that should help you in preparation for the registration assessment. So just a little bit about me to begin with, and it's actually funny, I was thinking I need to change this picture because it's been the same one since I joined the platform in 2023. So my name's Nkasia, or just NK for short. So my current role is I'm the lead pharmacist for general and specialist medicine at Astra and St. Peter's Hospital, but I'm also the lead for MicroPharm as well, and I joined in 2023 around, I think it was September 2023. So I did my MPharm up in Durham. I was in that cohort of pre-reg pharmacists who was affected by COVID. So I was actually provisionally registered from 2020 until 2021, where I could then finally sit the exam when they had sorted out how they were going to assess pre-reg pharmacists. I've done a few different specialties. I did a very short stint as the lead pharmacist for hematology and oncology from November 22 to mid 23. And then since then, I am the lead for general and specialist medicine. Outside of that, as I mentioned, I'm the lead for calculations on the MicroPharm platform, but I'll also dip into other areas as well, since medicine is quite broad. I did my independent prescribing qualification in asthma COPD management. So I actually run an extended access clinic in primary care and a GP surgery on a Saturday. And I also do a little bit of work between both primary and secondary care. So a variety of different things. But for the most part, it's all enjoyable and all kind of relates back to sort of pharmacy and education. So just to sort of get the ball rolling, it'd be really good to get your perspective on calculations. These are just a few things I've heard different trainees, either that I've supervised or taught about calculations. Some of you will say that they're impossible. Mainly, there's a shared hatred about dilutions. Variable rate questions are also a pet peeve, and rounding is also a challenge. Is there anything else here that people want to just add to the chat that I may not have captured on this slide? I'm sure there are many things about calcs that people don't like, but is there anything else? So time consuming. Um, let's see what else. Someone said, I hate dilutions, sequential dilutions, agree with that. Timing's a massive thing, displacement, too many steps, identifying what it's actually asking you. Suppositories and allegation can be confusing. So I'm going to say now, allegation is no longer part of the registration assessment. Now, inevitably, you'll all get added to a group chat by someone that you don't really know, um, and you'll get random questions that look like they've been written since the very beginning of time. Allegation isn't part of the registration assessment anymore. So even though dilution still are, allegation specifically is not. So that's one less thing to hopefully worry about. Questions are really wordy, moles, a variety of different things, and yet it was very wordy compared to past papers. So, okay, there's a lot of different things here to talk about. And hopefully, the advice that I'm going to impart on you this evening is going to address a lot of these queries and concerns. So before we actually jump into questions, I'm going to go into some of the things that I think are really important when it comes to tackling some of these questions. So these are some common questions. How do I avoid running out of time? How do you understand the questions? How do you even answer the questions? And actually, why the question's so difficult? What number am I meant to use? And which equation am I meant to use? Now, firstly, what does the exam actually look like? So quick show of hands, no shame, it's an honest, safe space. Who here has gone onto the GPhC website and had a go at some of these example questions to see what the interface actually looks like? If a lot of you say no, understandable, it's okay, a lot more yeses. Okay, so a mixture here. Okay, some of you have, some of you haven't. One of the one of the biggest things that I would say is useful is knowing exactly what to expect. Because when it came to my registration assessment, I was fully prepared for paper. But then after the pandemic, I was then sat in an exam center and it was all on a computer. So just getting used to knowing how I was going to input that information made a massive difference when it actually came to the registration assessment. You're going to have 40 questions, and you only have 2 hours to complete these, and you will be able to use a calculator. The online interface does have a calculator and it has a highlighter tool, but I'd recommend having your own calculator, which I will touch on very shortly. So time management. This is the first thing that I think a lot of you brought up. You have 2 hours to complete 40 calculations questions, assuming you don't qualify for extra time. So that is 120 minutes, and that's over 40 questions. So you've got 3 minutes per question. Who here feels like that's loads of time? Who here feels like that's not enough time? And either way, why do you think it's enough time or it's not enough time? That's how long it takes me to read. Depends on the question. Okay. What I quite like about you guys at the moment is that you're not giving quite binary answers. You're giving a bit of a mixture. So it depends on the question. And I think that's a really honest answer. And that's what I would also advise. You will come across some questions that don't take you 3 minutes. They only take you about a minute or so. You will have other questions that will take you 5 minutes. But hopefully it all kind of balances out so that on average, you're spending about 3 minutes per question. At this point in time, when you're very early on, what I really want from you guys is when you're practicing to practice on accuracy. If you're accurate, then you can always build up speed later on. Because by practicing questions regularly, you will pick up on patterns and you will pick up on a technique that will then allow you to then work faster. I wouldn't work quickly and then work on accuracy because it doesn't quite work that way. So that's the way that I would look at that. Um, so someone has just asked if we qualify for extra time, when do we submit the application form for extra time? I think I would have thought that would happen around the point where your supervisor is saying you're ready for the exam, but I would make the GPhC aware as soon as applications for the registration assessment open. But they should submit some more guidance closer to the time, is what I would say on that front. So that's what we say on time management. And this evening, I will get you guys to time yourselves, or rather, I'll time you just using my phone. 3 minutes per question. It's not to freak you out. It's to hopefully give you some confidence with some questions, and then just illustrate that other questions will take more than 3 minutes. But it's all swings and roundabouts is the way that I would phrase it. Number two, calculators. You have an on-screen calculator. I would not advocate for its use because hopefully when you're practicing, you are practicing with a calculator. And the GPhC will only allow approved calculators that are on this list. Okay. So how many of you have already gone out to Amazon and bought one of these calculators? Or who here still has that calculator from uni? Because the chances are there'll still be one in the same. Okay, all of you have. Yep, and don't like it. Yeah, I mean, what I would kind of say is that these aren't nice calculators. They're quite simple. They're quite straightforward, which is weird because at GCSE or A level, you have one of these nice scientific calculators, and you end up going to one of these really straightforward calculators. Okay, um, what I would kind of say here is find a calculator that you like to use and then just practice with it. I quite liked the Casio MX8B. It's quite large. It works for my decently sized fingers, and it's not too tiny because the Aurora ones are really, really small. Um, the main thing is that you find a calculator that you like to use and practice with it. Because if you practice with the same calculator, again, that will help with your accuracy, and again, that will help with your efficiency. Okay. Um, Now I know cost of living crisis, but I also know that pre-reggers get paid a lot better than when I was a pre-reg. So £3.49, £5 hopefully isn't going to break the budget too much, especially if you already have your calculator from uni. Okay. So what I would say, buy one, buy two, have a spare because you never want to show up on the day and then one of your calculator breaks. Um, have to just have the same model that you'll always use when you're practicing calculations questions. Because ultimately, what you're doing is you're preparing yourself in the way that you would then, well, you're optimizing yourself for how you'll then perform in the exam. There's no point in practicing calculations questions now without using the same calculator and the same equipment that you're then going to use come either November or the summer. Okay, so again, it's just about preparing yourself before we actually get into doing any of the questions themselves. Number two, understanding the questions. Now, these aren't just calculations questions, they are questions about pharmacy practice from a calculations perspective. Now, this might sound quite airy-fairy. It doesn't really sound like any tangible advice, but it is important. And the reason that I say it's important is that these aren't just calculations in isolation. And you'll realize that because as you're practicing certain types of calculations questions, you'll pick up on little things here and there that will only make sense because it's pharmacy practice. So, for example, for those of you who are used to health economics questions, you'll have learned that with NNT, so numbers needed to treat, and NNH, numbers needed to harm, for NNH, you tend to round down, and for NNT, you round up. And the only reason for that is because we like to be conservative when it comes to thinking about risk and benefit when it comes to medications. But if you were looking at it purely from a maths perspective, your rounding might be different. And so it's all about thinking about what these numbers mean in the context of the question in front of you. Okay. Let's have a look at a worked example together, and hopefully you'll see what I mean, especially as we go through more examples together. Now, we've got a 6-year-old child here who weighs 18 kilograms, and this child is prescribed an oral dose of 120 milligrams of drug A 3 times a day. You have available to you an oral solution containing 4% weight per volume of drug A. What volume in mil of the oral solution do you require for a 7-day course? Give your answer to the nearest 5 milliliters. So what I'm going to do now is I'm going to just take my phone, I'm going to get my timer up, and I'm going to time you all 3 minutes. Okay. And then when time's up, I'm going to say, right, that's time up. Put down your pens or however you want to answer the question. If you do want to answer the question beforehand, just send me a message directly in the Zoom chat, just so not everyone is given the answer because we're going to go through it together anyway. Okay. But if everyone's ready, I'm going to press the timer now. So your time starts now. You've got 3 minutes to have a go at this question. Someone said these all take about 30 seconds, but you probably get one question like this in the exam. Not necessarily. So what I will say is towards the by the end when I did the registration assessment, I had an hour spare left for calcs and I didn't drop any marks. So it's entirely possible regardless of whatever questions you come across. Okay. And what I will say is that I don't think I'm particularly good at calcs by default. It's just practice and technique, but we'll get there. It's nothing to stress about. Okay. So I think in the interest of time, so we can get through as much content as possible, we'll press pause there. Yeah, what I would say is if you can try and just make sure you message directly, just not give away the answer. But otherwise, all of you got the right answer, 65 mil. There were a couple of you who actually got the answer wrong. And when I went over this, you then went back and said, oh, okay, I see where I've gone wrong. I've multiplied incorrectly or I've divided something incorrectly. Now, going through this step by step, and I've broken it down on the slide, just to sort of expound on it a little bit, there are two questions that cropped up. The first is, well, what does it mean by the nearest 5 milliliters? So this is just a form of rounding, where you are either going to round up or you're going to round down. Now, the easiest way for me to think about it is if it's to the nearest 5 mil, then your measurements are in denominations of 5 milliliters. So 60, then 65, 70, 75, 80, 85, etc. And so in this case, if you're ever worried about rounding, just ask yourself which um, number is closer. So if you have an answer of 63 milliliters, which is what you calculated, is 63 close to 65? Or is 63 close to 60? The simple answer is that 63 is close to 65. So in that respect, that helps you in terms of your rounding. Now, someone's asked, if it was 62.5, what would you do? Would you round up or would you round down? And what I would say to that is that it depends on the question. In this case, I would probably make the argument you would round up. And this is where you have to sort of think about things again from a pharmacy perspective. If you were to shortchange the patient with the prescription, is there a chance the child could then not get that last dose they need to complete the course? If the answer is yes, then from a med safety perspective, you could make the argument that you'd be better off rounding up. But what I would say is that in the actual GPhC assessment, you don't tend to get questions where there is ambiguity as to what the right method is with calculations. It's very clear as to what the correct method is. Because if there's ambiguity enough that half of you who sit the exam say one thing and the other half of you say the other thing, then when the GPhC then moderates it, they'll just remove the question in its entirety because then it's not really a good measure of how you would safely practice as a pharmacist. So that's the advice that I would give there. Um, but otherwise, what you can all see is okay. So someone said there are some questions where they ask to give the answers to the nearest zero point 0.1 mil or 0.5 mil. So in that instance, again, let's say it's to the nearest zero point 0.1 mil. Those ones tend to be you could have to two decimal places and then you'd round up or round down appropriately. Similar 0.5 mil. So you'd either round up or round down. So just always ask yourself what's closest. So if this number is closest, you round down. If this number is closest, round up. But always remember to think about the clinical context of the question. Again, this is about pharmacy practice. It's not just calculations on their own. But all of you did really well with that question. So that's a really, really good starting point. And again, it reinforces that not every question will take the full 3 minutes. Let's move on. Here's another one. A patient takes Toujeo SolarStart insulin pens, so insulin glargine 100 units per mil. Each pen is 3 milliliters and a box contains 5 pens. The patient has type 2 diabetes and takes 42 units subcut once a day. How many days will 5 pens last? So again, I'm going to set the timer. Your 3 minutes officially starts now. Again, if you're going to share your answer, send it to me via direct message on the chat, just to not give away the answer, to give other people just a chance to try and figure it out. But these questions I quite enjoy because I always anticipate a little bit of variation in the answers. Okay, but your time starts now. Okay, so I think we'll call time there. Um, so the correct answer, and again, just try and move the answer to, you can create a new chat and then just select me. Again, it just means that the answer is not given away for people who still trying to work it out. Um, the correct answer here was 35 days. And this was a really good question, actually, because some of you private messaged me got 35 and some of you got 36. And that's actually what I was banking on because what it really emphasizes is the importance of thinking about things practically. Now, I'm sure a lot of you have already done or are doing your dispensing rotations. Oh, timer, there we go. You're already doing your dispensing rotations, or maybe you're doing your logs, etc. Um, and when you're dispensing insulin, if you really think about it, and if you've ever read the SPC, before you give the first dose, patient has to prime it. And if they're priming the pen, that's some units lost, firstly. Also consider that when patients inject, they need to use one pen to inject. So we wouldn't get them to give part of the dose with one pen and then part of the dose with another pen. So you're really thinking about how many full days can the patient get from one pen. If they're injecting 42 units a day, 42 units into 300, you get some weird 7.14, etc. days. That's 7 days. So 7 full days. If we know that one pen lasts 7 days, 5 pens will last 35 days. If you took it from a pure maths perspective and you did 7.1428 times 5 and then got to 35.7, which I saw some of you do actually, but then you correctly rounded down to 35, some of you would have rounded up to 36 days, and that would have been incorrect because the patient actually can't get 36 full days of insulin from the 5 pens that we've dispensed them. So this is where, from a practicality perspective, you really need to sort of think about what's going to happen in practice. You could even make the argument that they won't even get 35 days because this scenario that I've put together doesn't include priming the pen or potentially any dose wastages for other reasons. Um, so someone's asked, when we answer the GPhC questions, do we answer consider pharmacy practice? Absolutely. You do because at the end of the day, part one and part two are both, they're all pharmacy, it's all pharmacy practice. With part one, you're just using numbers to express pharmacy practice. And in part two, it's clinical, legal, OTC, it's everything else. Okay. Um, when you prime the pen, oh, so someone's asked, I rounded down after you got 35.1, 35.7, but do you recommend it to do it individually? So I would personally do it individually, because if I do it individually, I know there's no chance of me missing that 35.7. Oh, I have to round it down to 35. But if you do that, if that works for you reliably and you can remember to do that under pressure, that's fine. It's all about assessing risk. If you know that you're likely to panic in the exam just because of the time and you'd round up, then I personally would figure out how much one pen lasts and then work from there. That would make more sense to me. When you prime the pen, how many units do you lose? I think it's about 2 units, 2 to 4 units. I mean, you say, correct me if I'm wrong. I think that may be roughly what you lose when you prime a pen. Um,
Yeah, but when you prime, you'd lose about. It's whether or not you. So the losing the units, you don't technically lose units, and that's primarily because if you look at how an insulin pen is mechanically, it's slightly lower than where it needs to be to in order to push the insulin out. So you may lose a couple of units, but at the same time, most of the time you're pushing air until you get to that base. And then you'll see a few units come out, and then you say, okay, I'm ready to use the insulin. So realistically, you probably use 2, 3 units, but the rest of the like 5 units is air.
okay. All right. Awesome. Yeah. So just about that. So that's actually quite useful. Thanks. Yes. Yeah. Um, so can they not use, for example, the last units, 20 units of one and 22 from the other? So again, this is where pharmacy practice comes into play. Let's say, for instance, so one of the things that hopefully you learned is when it comes to injection, they tell you to rotate the site, don't they? if you were to inject 20 units from one and 22 from another, what if the patient injects at the same site and then you end up with that lipodystrophy? Okay. Generally, it's not recommended that they do part and part. It should be from a full pen. And if you can't get a full dose, then discard the pen and move on to the next one. Um, but then that's assuming that they're pre-filled pens. Some instances have the pen itself, and then you just put in new cartridges. So like the Nova Pen 6s, for instance, you can get like Deglodec or cartridges for that as an example. So yeah, no, definitely you're thinking about pharmacy practice. Um, if the question says assume no wastage, do you round up or down? Well, I think this again depends on the question. If the question assumes no wastage, um, if the question says explicitly round down to the nearest number or round up to the nearest number, which sometimes it will do, then from that perspective, you would then just follow what the question asks you to. Um, And then, sorry, you just asked about breakthrough pain calculations. So what we'll do, we'll make some time at the end, and so I'm gonna react to that now as a reminder, and I will come back to that towards the end of the session. We'll make some time to sort of do a bit of a Q&A about like breakthrough pain, etc. So let's have a go at this question. So this one's more about which numbers am I meant to use, particularly when you have dilutions and different concentrations, especially when you see stuff like 1 in 8,000, because no one likes concentrations being expressed in that manner. Um, so we'll have a go at this one. Potassium permanganate solution 1 in 8,000 is prepared from a stock of 10 times the strength. A patient has been directed to use 200 ml of the diluted solution every day for 10 days. How much potassium permanganate in grams will be needed to make sufficient stock? Give your answers to the nearest two decimal places. So again, I'm going to get the timer, and I'm going to hit the the start button now. So you've got 3 minutes. And again, remember, if you want to share the answer, then either click a new chat and then select my name, or you can hold on to your answer, and then we'll go through it together anyway. So either way, that's fine. Okay, time is officially up. So the correct answer here was 0.25 grams. So if you got that, well done. A lot of people responded, so I'm just going through everything now. Um, for the most part, I think that was really good. There was definitely room here for a bit of learning. One was decimal places. So sometimes some of you were really close in that you got either 2.5 or 0.025. So just be mindful when you're dividing. Okay. Now, I think the thing that I'm going to talk about here with dilutions and concentrations in particular is the fact that when we see wording or phrasing like this, so 1 in 8,000, okay, um, it's just another way of expressing concentration. So 1 in 8,000 is the same as saying 1 gram in 8,000 milliliters. Now, in this case, I made it a C1V1 type of question because I find C1V1 easiest to use, and I know the majority of you probably do as well. And so if you can relate 1 in 8,000 and convert that to X in 100, you then have it as a percentage because percentage is per 100. And then you can just use C1V1 accordingly the same way you would have done at uni. So this is just, in my opinion, one way in which you could take these questions and make them a little bit more digestible. Because I'm sure that if these were just expressed as a percentage in the question, all of you would have got this correct. But the fact that it was expressed in 1 in 8,000 or 10 times the strength, it throws people off. And understandably, because you might not think that way in everyday practice. Okay. Um, so that's the way that I would look at it. Additionally, some of you maybe misread the question. So you may have said, oh, what volume might be required, or what is the concentration, or something to that effect. Again, all easily done. What you'll have realized when we looked over the mock kind of platform that the GPhC uses, there was a highlighter tool. Please make use of that. Before you even start attempting to calculate anything, highlight relevant bits of information in the question so that you're focused, so that you don't get lost in all the different numbers trying to make sense of what they mean. Make sense of what they mean and then formalize your strategy as to how you're going to answer them. Don't try and answer it and then work out the strategy retrospectively because then you end up wasting time. You're just not as time efficient. Um, 10 times the strength always confuses you. Again, understandable. I think it's just about trying to contextualize it. So if we say that something has a concentration of 10 grams in 100 mil, to 10%, and something is 10 times stronger, then you could either say that is 10 gram in 10 mil, because that would be 100%, wouldn't it? Or you could say 100 grams in 100 mil. Again, that's still 100%. So you're thinking, again, remember that concentration is just a measure of how much of something in relation to a volume. So if you say you've got something 10 times stronger, it's either stronger because you have more solute or you have a lesser volume. It's one of the two. Okay. Um, Someone's asked, so we needed it from the diluted solution, not the initial. So in this scenario, okay, um, the potassium permanganate 1 in 8,000 is prepared from a stock 10 times this strength. So that means that the stock is 10 times stronger than 1 in 8,000. You could either say that's 10 gram in 8,000 mil, or you could say 1 in 800, but it ends up being the same because that will be 10 times stronger whether you look at it from the perspective of solute or whether you look at it from the perspective of volume, one of the two. Okay. So then what I then did was converted that all into percentages. So then 1 in 800, which is the same as zero point 0.5 and 400, same as 0.25 and 200, and 0.125 and 100. So that's your stock solution, which is 10 times stronger. Your diluted solution is 10 times weaker than that. So 10 times weaker than 0.125 would be 0.0125. And then you can just plug that into C1V1 and C2V2 accordingly. Some of you may think this is super long-winded. What I would make the argument of is that it doesn't really matter what your method is, provided that it's repeatable. Um, so explain the C1V1 method in this scenario. So when we think C1V1, what you're saying, so the C1V1 calculation, does anyone know what it means? what does the C1V1 actually mean? I know we use it for dilutions and concentrations, but who here feels brave enough to explain what the equation actually means? Yeah, ratios of concentrations and volumes. So what you're basically saying is if I have two different solutions, each of varying concentrations, the amount of substance between them should be equivalent. Because what you're saying is that a certain volume of a certain concentration has a certain amount of stuff in it. And that would be equivalent to another solution with with a differing amount of solute and a different volume, but the concentration ends up being the same because the amount of substance between them is one and the same. Okay. So in this scenario, what we're saying is if you have, let's say, 10 gram in 8,000 mil, you have 1 gram in 800 mil. So in 100 mil of that, you have 0.125 grams. Okay. That's how much substance you have in that 100 mil. So that's that concentration. Okay. But then your other solution is 10 times weaker. So you have 10 in each 100 mil, you have 10 times less. So in order for C1V1 to make sense, for you to say that the amount of drug between the two solutions is the same, you have to have 10 times the volume to compensate for the fact that you have 10 times less the amount of solute. Okay. So it's like comparing it to orange squash, for instance. Okay. You could have just the concentrate. Okay. If you have the concentrate, you have, let's say, 5 grams of sugar. Okay. And that might be, I don't know, a certain concentration. If you then dilute it, you have the same amount of substance, but the volume has changed, so the concentration differs. Um, so a few other people have got some different ways of working it out. Um, I only multiply 2,000 mil by 1 gram and divide that by 8,000. You get the answer 0.25. Will that be right? What you'll realize is that there are different ways in calculating the same answer because what you're doing, even if you're not doing C1V1 and C2V2, is you are drawing comparisons between the different concentrations. So what you'll realize in a lot of these slides and a lot of the videos on the platform is if you can work out the same answer differently. I think the important thing here is that whatever your method is it's reliable and it's repeatable. Um, so that's the main thing. Just a couple of other questions. So someone said that they learned that when it's ratios, you divide the second number by the strength. So if it's 10 times stronger, the second number divide by 10. But if it's a percentage, you multiply the first number by strength. So I would probably say, and again, this is me personally, remembering those types of rules with percentages and ratios feels complicated. And the moment you introduce rules that feel complicated, you're more likely to stress in the exam as to, oh, what do I do in this situation? Or what do I do in this situation? I would probably say just take the numbers at face value as they are, and then think, again, holistically, when we're thinking about pharmacy practice, how you would go about answering the question. With calculations, provided that you have the context, I wouldn't worry about being too formulaic with it. Your formulaic approach will come from practice rather than trying to remember, do I do this in this scenario all the time, or do I do this in this scenario this time? Um, and I think, for those of you who said it, you need to be able to rationalize it. Yes, I agree. You do need to be able to rationalize this question. Okay, you need to be able to rationalize any question. And if relying on a pattern helps you rationalize it, that's great. I would say that the rationalization still needs to exist, and most of that will come through thinking about the context of the question. Okay, does that make sense to everyone? We will have some time to go through some questions and answers towards the end of the session anyway, but I do want to go through some of the other bits of content that you might want to sort of address. So these are all the different question types in the registration assessment. Have all of you gone through this list and done a traffic light system of what you find easy and what you find difficult? Again, honest answers. A lot of yeses. This is actually really, really good. Um, if you haven't already, please do so. This list is on the GPhC website. Just print off this list and highlight stuff that you think is. So if you find doses and doses regimens really easy, highlight it in green. For those of you who find health economics challenging, highlight it in red. And for molecular weight, somewhere in the middle, highlight it in orange. Okay. And then you know how to spend your time in terms of practicing some of these questions. Okay. Some of you have already said that you've learned these off by heart because I've mentioned these in every video. At one point, I had to stop mentioning them because I mentioned them so much. But yes, if you've already gone through some of the content on the platform, you'll realize that I keep referring to it. And it's really, really important because then you know, oh, this is this type of question, this is this type of question. Okay. So that's what I would say in that respect. There is another question about past paper resources. I will come back to that when it comes to the Q&A section because we've still got a little bit of time this evening. So I'm going to give you all a bit of a choice now. I have a few questions on dilutions. I've got a few questions on infusion rates, so we could do that. Or I have a few questions on pharmacokinetics. So what would you like to cover? We've got
What
about,
I'll do, just to make your life easy, I'll set up a poll.
oh,
Uh,
excellent.
so it was between dilutions,
Yep,
infusion rates,
yep. And
and
pharmacokinetics.
pharmacokinetics. I'm just gonna put PK. Cool. I'm gonna launch a poll and we'll judge it from that.
Oh, dilutions and PK are neck and neck. No love for infusion rates. No love for infusion rates.
Okay.
So someone's
So close.
asked, do we get the slides afterwards?
We don't do slides, but recording, yes.
The recording is
So
there.
you put the recording on the free plan.
Let me see. Dilutions always
Oh
comes up.
God, you're so close.
Oh, this is actually really close. I'm tense for you guys, and I'm not even practicing the questions.
Yeah.
Oh, I think dilutions is won by
Yeah, dilution's
2%.
about 3 votes.
Oh, that's close. All right. Dilutions it is then. All right, we'll go over dilutions. But then there's loads of stuff about PK and infusion rates on the platform anyway, so don't worry about it. And by the end of the year, you'll be so saturated with these questions that it won't even matter. Because you'll go through all of these all the time anyway, so I wouldn't worry about too much. Um, so that's fine. So, dilutions. Um, this may sound a bit silly in terms of explaining. It's not silly because I don't think we do a great job as a whole, like during your MPharm degree, etc., sort of explaining through what things are. But dilutions just involve making a solution weaker by adding more solvent. So similar to what I said before, it is just a measure of how much of something you have in a given volume. Okay, and this is generally done to achieve a desired concentration for either enteral or parenteral administration. So, as I mentioned in my introduction, I'm predominantly based in secondary care. So, for dilutions, quite often we'll dilute a drug so that it is safe to give parenterally, because too high of a concentration can be not necessarily such a toxic, but it can sort of cause damage around the cannulation site, etc. So that's something to sort of bear in mind. I think dilutions could be challenging because there are loads of different numbers involved or different units in the same question. Um, so um, just replying to a question. So it's really important that when you're going through these questions, you highlight relevant bits of info, and then you kind of keep track of what's happening and where. So again, I'm going to sort of talk through these questions instead rather than get you guys to have a go at them and then go through the answers. So how many mil of water has to be added to 250 mil of a 1.26% stock solution of sodium chloride to dilute it to 0.9%? So the formula you're not often given in the exam, but I've given you the formula here to be nice, C1V1 and C2V2. Again, as we said before, C1V1 and C2V2 is a way, it's a numerical way of being able to what's the word I'm looking for here? Being able to equate two different solutions of the same amount of substance. Okay, that is what C1V1 relates to. So here, 1.26% is the same as saying 1.26 grams in 100 mil, and 0.9% is the same way saying zero point 0.9 grams per 100 milliliters. Okay. Now, the only way for you to get from 1.26 to zero point 0.9 per 100 mil, again, you're thinking about it proportionally, is by adding more volume. So this question is asking you how many mil of water must be added to 250 mil to dilute it to 0.9%. Now, when you do your C1V1 question, the volume you'll get is not the volume of water that's added, it is the volume. Let me see, just going to ask another question. There we go. Um, it's not the volume that is to be added, it is the final volume. So this question or this calculation tells you that 350 milliliters of sodium chloride at 0.9% is the same as 250 mil or 1.26%, that they're equivalent, they have the same amount of sodium chloride as a solute. But the question didn't ask you what the volume of 0.9% is. The question asked you how many mil of water do you need to add? So your final step is 350 minus 250 to give you 100 milliliters. And actually, in an exam, it is very easy to just do C1V1, you get an answer, yep, done, move on to the next one. But remember, you've not actually answered the question. There's one more step left. So I would highlight bits of the question here so you remain focused on what the overarching aim is so that you're not missing on these potentially easy marks. Okay. Now, another type of question, so in other situations, you may want to get a desired concentration by mixing two or more different solutions. And in these scenarios, what I would probably say is, again, think about things holistically. So rather than trying to do a super clever calculation, just break it down nice and easy. So the question here, what is the concentration of dextrose in a solution prepared by mixing 150 ml of 10%, 50 ml of 20%, and 300 ml of 5%? When we see these units, weight per volume, does everyone understand what that means? That weight per volume part. Let's see what people have said. Everyone understands. Okay, yeah. So grams in 100 mil. Great. And it's really important that you do understand those units because it means that you're not going to get confused when it comes to these concentrations. And you can highlight those units as well because they're just as important as the numbers themselves. So 10% weight per volume is 10 grams in 100 mil. If you have 150 mil, you therefore know you have 15 grams. 20% is the same as saying 20 grams in 100 mil. If you have 50 mil, you'd expect half of the mass, so you'd have 10 grams. And 5% is the same as saying 5 grams in 100 mil. So 300 mil would be 15 grams. Okay. And the reason that I've written all that down and broken it down is so you can also sense check a lot of your answers. What you don't want to do is go through the questions and then get what your calculator gives you, write it down, and then move on. What you want to be able to do is when you're going over your answer, think, does that look right? Does that sound right? And sometimes by just breaking it down in nice, simple steps, you're more enabled to be able to do that, okay, in a nice, easy fashion. Here they've asked you to give your answer to the nearest whole number, okay, uh, which most of the time in the GPhC assessment tends to be a nice, easy number to work with anyway. Again, the aim here isn't to trip you up. The aim here is to sort of for you to demonstrate to the GPhC that you'll be able to practice safely. So here are some multiple choice questions. Okay, so potassium permanganate is often available as a concentrate that requires dilution. What is the percentage of the concentration that requires a 1 in 50 dilution to produce a 1 in 8,000 final solution? These questions nobody likes because the whole requires a 1 in 50 to produce this can be quite confusing to people just because of how it's phrased. If you rearrange the question instead to say, what percentage of the concentrate do you start off with, where if you dilute it 50 times over, you get 1 in 8,000? If I phrased it that way, the question would probably be a lot easier to sort of digest. So all I would do here is I would say I've got 1 in 8,000. Okay, what is that as a percentage? So I could convert that into a percentage first and then figure out what 50 times that is. And that then gives me what my answer would be, which gives me 0.625. And one of you already beat me to the answer, which demonstrates that you're already thinking about things in a way that's repeatable, which is great. So yes, this question is just asking for the initial concentration. Okay. Can I write that down so I can visualize? Because I'm conscious of time, what I will do, I'll type out this one in particular, and I'll either get your sis to send it out or add it to the video in the comment section, one of the two. So I'll figure something out. So that's this question anyway. But yes, this one was just asking for initial concentration. Here's another one. So an ampule contains 12.5% weight per volume of active ingredient. The amps 10 mil. How many amps are needed to produce a 1 liter bag of final concentration 0.5%? Okay. So if you think 0.5%, well, 0.5% weight per volume, that's 0.5 grams in 100 mil. In a liter bag, at least it's 1,000 mil. So we're going to expect 0 0.5 times 10. So we're going to expect 5 grams, aren't we? Okay. So in that respect, we're then thinking, okay, well, how many amps do we need here? Okay. So 12.5 grams in 100 mil. Okay. We want 5 grams in a liter. We can then go about figuring out what the answer is just through a little bit of division. Okay. Now, hopefully, all of you have already figured out what the answer would be, and you've probably already done it without even having to do the calculation. And again, this is where we think about pharmacy practice and practicality. Without doing any kind of calculation, does anyone want to have a bit of a punt at what the answer would be? Okay, great. Everyone is saying 4B. Okay. And there's a very straightforward solution reason for that. You can't practically give half of an ampule. You can't practically give a quarter of an ampule. So it can only really be 4. It's not going to be 10 because 10 is going to massively overshoot what the concentration is that you're looking for. So with some of these questions, you're able to sort of suss out and sense check, okay, is this correct? Is it not correct? Okay. So again, it's just all about thinking about pharmacy practice. Okay. Um, the previous question, let me see if there's another question after this. And if so, I'll come back to you. But if not, then okay, that was it. Okay, so the previous question is this one. Fine. Um, great. So in summary for this evening, and I am going to go over the questions, so don't worry, don't panic. There were at least 2 questions which I will address. That's been this workshop at the very least. Okay. I'm just going to go over to the final slides before I then go over some of the specific questions that I've been asked this evening. Okay. Remember your time management. Okay, so you've got 3 minutes per question. If you get stuck on a question, you can flag it, come back to it later. There's no point in losing loads of time on one question when you could potentially smash a few other questions. Okay, again, remember thinking about the context of the question. You're going to be a pharmacist. You're going to qualify at the end of this assessment. So ultimately, you need to think about how you would answer these questions in practice, okay? Either by another healthcare professional or a member of the public. And also just make sure that you're highlighting parts of the question to break it down to make it easier. There's no medal for, answering the questions in the most complicated way. By the end of the registration assessment, I had just drawn random doodles all over my scrap paper to make the questions make sense. Whatever works for you, utilize it. The main thing is repetition and consistency. Okay. Um, I will go over some of the answers, some of the questions that people have asked actually. So I'm going to do that now. The first one was about breakthrough pain. So I'm going to go back to that one since palliative care is, interestingly enough, one of the areas that I cover anyway in my day job. So breakthrough pain calculations. So when we think about patients who have long-term pain needs, I'm going to use MST as an example here. What you want to achieve is something like background pain relief and breakthrough pain relief. Now, when you're firstly trying to calculate background pain relief, we generally advise that we put a patient on an immediate release opioid for maybe 24, 48 hours generally. We assess how much they need, and then we'd add it all up and then divide by two, because MST and most slow release formulations get released over 12 hours, so morning and evening dosing. The breakthrough pain doses are between a sixth to a tenth of the total amount of opioid that they need in that 24 hours. So let's say, for instance, you have a patient that requires 60 milligrams of Oromorph in 24 hours. You calculated that to be your average. You would give them 30 milligrams morning and evening. And then after that, you would give them a sixth to a tenth of that total dose. So a tenth of 60 would be six, and then a sixth would be 10. So anywhere between 6 to 10 milligrams, and you could give that 4 hourly when required, for instance. Because the hope is that if you've optimized their background pain management, they're going to be less reliant on that when required breakthrough dosing, unless something were to occur and you need to retitrate their medication up. So hopefully that answers that question. Now, when questions ask about breakthrough pain, they may stipulate the minimum required dose or the maximum required PRN dose. If it's the minimum required dose, then you're looking at the smaller end of your range, because a tenth is smaller than a sixth. But if you want the maximum, it would be a sixth. Okay. And they wouldn't give you a question where they arbitrarily say, okay, well, something in between, because that, again, that doesn't really assess your ability to practice safely. That would just be a question that would be there to trip you up, which isn't what the registration assessment is there to do. So hopefully that answers that question with regards to breakthrough pain. Um, I know another question was about, hang on, I'm going to go back here. I think Sada, you had a question, but I think when it cut, it wiped. So if you could just tell me what your question was again, that would be much appreciated. It was about pharmacokinetics. Remind me of the question. Oh, pharmacokinetics questions harder than the university ones. Um, so I think it really depends on the uni. Some of the uni questions are from a lot older papers, and those ones, I think some of them are incredibly challenging for the sake of it. So I wouldn't necessarily say that the GPhC ones are are harder than those. I think the GPhC ones are fairly run of the middle. Like they're not designed to trip you up. Like they are doable. Some of the past papers that you'll probably do between now and the registration assessment, you'll come across some really difficult questions. You'll come across some really straightforward questions. A lot of the PK questions might be about either half-life or bioavailability. They'll all be concepts that you'd come across as a pharmacist in practice anyway. Um, so I don't think the pharmacokinetics ones are too bad for the most part. I think with enough practice, you should be able to manage. Um, but with the different modules on the platform, I've gone through most, if not all, the different types of pharmacokinetics questions you could possibly get. And with plasma concentrations, I would say that sort of leans into half-life anyway. So it wouldn't be out of context. Like you'd have some kind of context around plasma concentrations, or they might give you a formula, which you might then need to be able to use. So that's what I'd say about PK. Um, can I give some tips on how to tackle wordy questions? Um, so wordy questions, I think the key thing here, firstly, just take a minute or so just to read through the question. Okay. Read through the question and understand what exactly that it is that they're asking you to do. When you've done that, highlight bits of the question that you can focus on, because not all of the question is going to be relevant to you answering it. So if you remember the pediatric question that I put together at the very, very beginning, um, at one point I mentioned in passing that they weigh 18 kilograms. That's not relevant to this question at all. Okay. Because when you read through the question, the only thing that is relevant is the dose, the fact that it's 3 times a day, and the oral solution that has this percentage, and the volume, 7 days, 5 ml. If you highlight those bits of the question, you can then say, okay, this is what the question's asking me to do. This is how I do it. I'll then just get on with it. So with the wordy questions, just take a moment to read it, understand what exactly it is they're asking you to do, and then from that perspective, then highlight and then tackle the question. Okay. Um, so someone's asked, can I go over the ampules one again? I'll briefly touch on that. Just, again, I'm just conscious of time. Oh, hang on. So this question about ampules, it's not this one. It's not this one. Here we go. Okay. So this question about ampules. Oh, that's a loom that's open there. Great. That's gonna have to stay there. So here with this question, you're told that the ampule contains 12.5 percentage weight per volume of ingredient. The ampules are supplied as 10 mil, and you're asked how many ampules are needed to produce a 1 liter bag of this concentration. So you know that zero point 0.5 grams is in 100 mil. Okay. Um, if you have if you need 1,000 mil, that's going to be 5 grams. So then what you're then thinking of is, okay, well, if you have 12.5 grams in 100 mil, so weight per volume, in 10 mil you haven't got 12.5. Okay, you only got 10% of that. So you've got 1.25. So if you need 5 grams, that's going to be the same as 4 ampules. Okay. So that's how you'd go about working out that question. Um, some of these questions you'll find in some of the other videos, some of them you won't. For the questions that are in other videos, I kind of go through it in a bit of a breakdown manner. If it's not, just drop us a message and I'll be more than happy to sort of go over them. Going over insulin pens, if you prime 2 units per pen for a pack of 5, how does this change the volume requirement? A question like this came up in the June 25 exam. Interesting. So they are thinking about priming. Um, so this really depends on what the daily dose of insulin they were having was. Because if they assume that you prime every single pen with 2 units, and let's say each pen has 300 units, and you prime it, and then that 2 units is then gone, then you don't have 300 units in that pen, you have 298. So you would then just need to factor that in with the daily number of units. But the principle of you wouldn't part dose using 2 pens still applies. So you would then say, okay, well, if I only have 298 units again, then that just means that I can only get X number of days out of that pen. And then you then just apply it and scale up accordingly. So the principle doesn't change. The only thing that's changing is what your total number of units actually is. Um, let's see, how some other questions. Someone's asked for this question that's on the screen. Can you do C1V1? Yep, you could do C1V1. So that's okay. And then yeah, someone's asked, would they make the questions harder because you're IP? Absolutely not. The actual there's no point in making the registration assessment more challenging because you're an IP, because the skill set that you have as an independent prescriber and the skill set for being a pharmacist, while they might overlap, they're different. They're different competencies. So this registration assessment is you practicing safely as a pharmacist. The independent prescribing aspect of this is superimposed on top of that. So no, the registration assessment is not going to be any more challenging because the IP element is in your registration year, so different altogether. Um,
And I'll just stop the recording now.
yeah.
But